Welcome back to exam key Point Dentistry. In today's video, we are going to learn about bone graft in a very simple and an easy way. So let's begin. So, what is a bone graft? So, a bone graft is a material that we place inside a bone defect. Okay, to help the body form the new bone. It is commonly used in periodontal surgery. Especially when we want to regenerate lost bone around the teeth. Regenerate lost bone around the teeth. Okay, so bone graft is nothing but is a material that we place inside a bone defect to help the body form the new bone. This is new form, and it is commonly used in periodontal surgery, especially when we want to regenerate the lost bone around the teeth. Okay, of the bone graft. So bone graft are mainly divided into bone graft materials and non-bone graft materials. Bone graft materials are autograft, allograft and xenograft. Autograft means which is obtained from the same individual, which is taken from the same person, and these are the best because they contain the live cells. Allograft, which is obtained from the different individuals of the same species, means it is taken from the another person of the same species. Xenograft means it is taken from the different species like a bovine. The example is cow bone. There are three properties which define a graft materials. So every bone graft works because of three major properties: osteogenesis, osteoinduction and osteoconduction. Osteogenesis means formation of a new bone by a cells contained in graft. This means new bone is formed by the living cells present inside the graft. Osteoinduction, this is a chemical process by which chemical molecule obtained in the graft by which molecule contained in the graft convert the neighboring cells into the osteoblast, which turn into the new bone. So this is a chemical process. Molecule inside the graft convert neighboring cells into osteoblast, which help make the new bone. Osteoconduction, this is a physical effect by which the matrix of the graft form a scaffold that favor outside cells to penetrate the graft and form the new bone. So this is a physical process. The graft act like a scaffold, allowing the outside cells to grow into it and form the new bone. So autogenous bone graft. This graft is taken from the patient own body. Okay, so this is a sources. There are the sources of the autogenous bone: intraoral site and extraoral site. Intraoral sites are healing extraction socket, edentulous ridge, maxillary tuberosity, ramus, bone from the osteotomy areas, while extraoral sites are tibia, iliac and autograft. So there are also techniques of the autograft are which can be used in osseous blend, bone blend, cancellous bone marrow transplant and bone swagging. Osseous coagulum. It is a technique using a mixture of bone, dust and blood. This technique uses small particles ground from cortical bone method. So first one is bone is removed from the carbide burr, that is 6 and 8 at 5000 to 3000 rpm speed, and then collected in a sterilite dependent disc. Means in osseous coagulum, which is made by mixing the bone, dust and blood, bone is collected using the carbide burr 6 or 8 at 3000 to 5000 rpm speed, and then bone is collected in a sterilite dependent dish. So advantages, it provides additional surface area for the interaction of the cellular and vascular element, means it provides more surface area and ease of collect. Disadvantages, inability to produce adequate bone for the largest defect, means there is quantity is limited and it is not enough for the large defect. Bone blend, to overcome the disadvantages of osseous coagulum, bone blend technique is used. So this method is used when more bone is needed. So what we will do in bone blend, first bone is collected, then we will place in a sterilized plastic capsule, then they ground into a smooth workable paste, then we will pack into the bone defect areas. Cancellous bone marrow transplant. The cancellous bone which is obtained from the maxillary tuberosity, edentulous area and the healing socket. So cancellous bone is taken from the maxillary tuberosity or the healing defect. The maxillary tuberosity contain the good amount of cancellous bone if the third molar are not present. So after a ridge incision is made distally from the last molar, a curved roger is used to remove the bone. So used for defect because cancellous bone contain rich marrow and good blood supply. Then the next one is bone swagging. So this technique requires an edentulous area adjacent to the defect in the bone. So from which the bone is pushed into the contact root surface without fracturing the bone at its base. So technique is difficult to use. So in bone swagging use when there is an edentulous area next to the tooth. The bone is pushed towards the defect without breaking its base, and it is difficult technique not used commonly. Allograft means they are obtained from the other individuals of the same species, means from the another person of the same species. They are mostly obtained from the cortical bone within the hours of the donor death. It is cut and washed with an absolute alcohol and then defrozen. It can either be demineralized or not. So there are the types of an allograft are freeze dry bone allograft, which is mostly osteoconductive, and demineralized freeze dry bone allograft, which is mostly osteoinductive. Osteoinductive means because demineralization exposes the bone morphogenetic proteins. So in this we will see the demineralized bone freeze dry bone allograft is work better than the freeze dry bone allograft because in this bone morphogenetic proteins is exposed, which is help in forming the new bone. So disadvantages of the allograft are, since they are foreign to the patient, can produce immunoresponse, which is avoided by the defreezing, radiation and the chemical treatment. So means there is a risk of immune reaction and it can be reduced by a defreezing, radiation and a chemical treatment. Xenograft, which is bone taken from the another species like a cow. So example is BioOs, means it is derived made from the bovine, that is cow bone. An organic part is removed but the trabecular patterns is remain. It is helping clot stabilization and the revascularization. So when BioOs is used within BioGuide membrane, it prevents the soft tissue from entering the graft area, and it is when it is combined with the P15 polypeptide, so it improves the bone regeneration. So thank you for the watching. If your videos is helpful, please like and subscribe my channel Exam Key Point Dentistry. See you in the next video.